This video is about the branches of the internal iliac artery. The aorta bifurcates into two common iliac arteries. The internal iliac artery comes off the common iliac artery at approximately L5. This crosses the pelvic brim and terminates in the pelvis, while the external artery continues into the lower limb. The internal iliac artery can be divided into an anterior and posterior division. The posterior division generally has four branches. These include iliolumbar, lateral sacral, superior gluteal, and inferior gluteal. The anterior branch has either 8 branches in females or 7 branches in males. The yellow stars indicate which branches are different according to gender. The anterior branch includes superior vesicle, umbilical, obturator, either inferior vesicle or vaginal, uterine, which only exists in females and has no male equivalent, middle rectal, and internal pudendal. The best way to identify the branches of the internal iliac artery is by identifying where they terminate rather than their branching pattern, just because it's so variable from person to person. So we're going to go through the arteries one by one and talk about what they supply and where they end. We already started talking about the anterior and posterior divisions. So we said the posterior division has 4 branches. 2 of those branches, being the iliolumbar and the lateral sacral, are going to go ahead and go back towards the body wall, while the superior and inferior gluteal are going to exit the pelvis and supply the gluteal region. So the iliolumbar artery can be seen right here on our diagram. It's actually going to go superiorly to both the psoas and the iliacus muscles, and then divide into the lumbar artery and the iliac artery. So we're going to see it coming out over here, giving off the iliac artery, and then the lumbar is going to continue more superiorly. The lumbar artery is going to supply the psoas muscle and the quadratus lumborum muscle, whereas the iliac artery is just going to supply the iliacus muscle. Our next artery is the lateral sacral artery, which we can see right here on our diagram coming down. This is going to go through the ventral sacral foramina and supply the dura mater and the sacral rami, and it has both superior and inferior branches. So again, just to reiterate, the way that we identify the iliolumbar is by its superior orientation going up and towards the vertebrae, definitely on the back of the body wall. And then our lateral sacral artery, we're identifying because of its connection with the ventral rami and its orientation again backwards towards the body wall. Next, we're going to talk about our superior and inferior gluteal arteries. The superior gluteal artery, which can be seen right here on our diagram, is going to go through the greater sciatic foramen into the gluteal region, and this is going to be above the piriformis muscle. And the piriformis muscle on our diagram we can see is right here. And we know that the piriformis muscle is going from the pelvic surface of the sacrum, which is right here, through the greater sciatic foramen and to the greater trochanter of the femur. So the last artery we're going to talk about is going to be the inferior gluteal, which you can see right here. And this is going to be running also through the greater sciatic foramen into the gluteal region, but the difference is that it's going to be below the piriformis muscle. This is also running with the internal pudendal artery, which we'll talk about in just a little bit. And so just to reiterate, the difference we're seeing here between superior and inferior gluteal is just the separation between them being the piriformis. So we find the superior gluteal artery superior to the piriformis muscle and the inferior gluteal artery inferior to the piriformis muscle. Now we're going to move on and talk about the anterior division. The first 4 branches that we're going to talk about are branches that are identical in both females and males. So this is going to be the umbilical branch, the obturator, the middle rectal, and the internal pudendal. Of all the anterior branches, both the obturator and internal pudendal are going to leave the pelvis, while the rest of the anterior branches are supplying the pelvic viscera. The obturator artery, which is shown right here, can be identified because it's going through the obturator foramen. It's running with both the obturator nerve and the obturator vein to go to the medial thigh. We can see the obturator foramen right here. It's a gap that is not covered by obturator internus, or the obturator membrane. Next, we're going to talk about the internal pudendal artery. This artery, as shown right here, is going to exit the pelvis through the greater sciatic foramen. This is similar to the inferior gluteal, which we talked about previously. The difference here is that the internal pudendal is going to give off several branches in the perineum and enter back through the lesser sciatic foramen. So although both the internal pudendal artery and the inferior gluteal artery go through the greater sciatic foramen inferior to the piriformis muscle, they have different courses. Additionally, oftentimes the internal pudendal artery will be more inferior. The umbilical artery terminates as the medial umbilical ligament, which actually ends in the body wall. So you'll find it embedded in the anterior body wall. However, before it terminates, it gives off the superior vesical branch, which is going to the superior bladder. So right here we would have a branch coming off and then its termination in the body wall. Additionally, coming off the umbilical artery, we often have the artery to the vas deferens in males. However, this would be very difficult to see in lab. And next we're going to talk about the middle rectal artery. So if we have our rectum right here, our middle rectal artery is just going to terminate in the rectum. Alright, so just to reiterate, when we're looking for umbilical artery, we're looking for it embedded in the anterior body wall. When looking for our superior vesical artery, we're looking for the superior bladder. When looking for the internal pudendal artery, we're going to be looking inferior to the piriformis. And then to confirm that we're looking at the internal pudendal and not the inferior gluteal, we're going to look at the course that it takes back into the lesser sciatic foramen. And then lastly, for the obturator, we're just looking for the obturator foramen, and it also is running with the obturator nerve. Now we're going to talk about the last couple branches, which differ from men to women. The first difference between men and women is that women have an extra artery, which is the uterine artery, and there is no equivalent in males. The second difference is that in women, we have the vaginal artery, while in men we have the inferior vesical artery. Just a heads up though, some texts debate whether or not women have the inferior vesical artery, but for the purposes of following the class notes, we're going to say that it's only present in men. So first we're going to talk about the uterine artery. The best way to find this is to go ahead and look for what's crossing superior to the ureter. In men, what crosses superior to the ureter is going to be the vas deferens, but in women, it's going to be the uterine artery. This is going to supply the uterus, the uterine tubes, and the vagina. And you can see right here, it's just going to go and terminate on the uterus. Next, we have the vaginal artery. And the best way to find this is to simply follow it straight to the vagina, which is going to be what it supplies. And you'll just see it embedded on the side. Lastly, we're going to talk about the inferior vesical artery, which is shown right here. In comparison to the superior vesical artery, it's just going to be more inferior. It's going to be more towards the neck of the bladder. It's supplying the neck of the bladder, the prostate, and the seminal gland. So really, for these three arteries, for the uterine, the vaginal, and the inferior vesical, you're just trying to follow where you know they're going to supply. And with that, we've covered all the branches of the internal iliac artery. Just to reiterate, the best way to find these arteries is not so much by a branching pattern, but by finding where they're terminating and where they're supplying. Good luck!